everyone, Jennifer Johnson here with Dr. Kenya Malcolm, who specializes in a lot of things, but including anxiety and parenting. And I think a lot of parents may be feeling some of that anxiety right now. So just wanted to talk through some advice as we just try to get through all of this. Right now we're on AC6. Pediatrics here at the Children's Hospital, and literally as we're talking, more moves are being made to get people out of this facility and do a lot of virtual visits. So don't be surprised if maybe you hear from your provider saying let's talk by phone or computer.
Absolutely.
So don't be surprised by that, but the staff is still here because we know you still have a lot of needs and they want to care for you as best they can. So a lot of work happening behind the scenes to continue delivering this care. So again, a lot of people might be feeling a little bit of anxiety, and we talked about the importance of setting realistic expectations in these times. Tell me about that.
Yeah, so I think one of the things that is so important, not just with the current situation, but in general, is to have realistic expectations. So I think that for some people, they see that we're doing the social isolation, we're trying to keep our distance from folks, and the idea that they have in their head is that that means that no one will be sick. And it's really inconvenient, it's really hard for a lot of people, so it will be really frustrating in another week or so when we start to get those numbers in about the people who have been infected and people who are feeling ill. But really the isolation is to help keep the numbers down and to make sure that the people who don't get well as quickly, so our elderly and our immunocompromised, to limit the exposure that they have. Most of the cases of COVID-19 are mild for the majority of people who are fairly healthy in the average age range of the folks who get sick. And we're really trying to make sure that the exposure and the spread doesn't overwhelm the system, but it doesn't mean that people aren't going to get sick. But it's still important for people to follow the CDC guidelines on that.
So realistic expectations for adults and parents, but also sharing those realistic expectations with your kids, right?
Absolutely. So what I've written and talked with folks about is not making it a monster. So when we talk about illness and we talk about infection or whatever we're talking about, that not to gloom and doom it so much when we're talking in front of our kids or talking to our children, because then when somebody does get sick, it feels like it's the end of the world. It feels like the monster is in the room now, and we really don't want that to be the case.
We need to be compassionate with ourselves, don't we? This is not a normal routine.
Exactly. So I've talked with a lot of parents and seen a lot of parents online talking about trying to maintain the same level to education, to family dinners, to spending time with their partner, all of those different things that are really coming to a head right now. They're still important, but we have to have some, again, realistic expectation and compassion, not just for ourselves, but for our children. This is different for them, this is different for us. We don't have access to the same things that we've had. We're staying inside more, but we can still go outside in our yard and play together. So I think having that compassion will really help us feel like we're able to manage things in a way that is totally okay without being perfect.
Without being perfect. You mentioned a lot of different relationships in there, with your partner, with your children. You says resilience happens with relationships.
Yes. So I think what is so important, particularly about children, but really about adults, and we've been learning more and more about this, is how important those meaningful relationships are for people. That they have a place to go when they're sad or mad or even excited, and they have the context of the relationship to help support them and get them through things.
Resilience.
That's right.
Key word here. We're going to leave it there.